Hello, my global friends. COVID-19 has been gone pandemic since early 2019. In the absence of vaccines, some scholars propose the herd immunity through natural infections to limit the COVID-19 spreading. As herd immunity has not been reached, people confused and question about it. To address them, we wrote a review article shown here, the title, How Will the COVID-19 Vaccines Help Shape the Herd Immunity Against COVID-19? Based on that paper, I'm going to discuss the herd immunity in a plain language so that the people without a doctorate degree can still understand. Let me first define COVID-19, which stands for coronavirus disease 2019. That is a disease caused by a virus named severe acute respiratory syndrome coronavirus type 2. In short, we call SARS-CoV-2. That is a viral pathogen. What is the herd immunity? It means that a high percentage or proportion of people in the community has protective immunity to certain infectious disease through either vaccination or illness, or what's called a natural infection. Herd immunity makes infectious disease unlikely to spread from person to person in the community because the virus cannot discover the susceptible hosts. Let me explain in this picture about herd immunity. In the community of 10 people, if 7 have a protective immunity, as shown in the green color, then the herd immunity will take shape where virus cannot attack them and where virus cannot spread among the community. Eventually, pandemic will die out. So in the herd immunity state induced by COVID-19 vaccine, for example, even people who cannot or have not vaccinated, such as newborns, we talk about babies, people with a weakened immune systems, can still get protection because the chance of a disease spreading in this community is very, very small. Herd immunity depends on infectivity of a disease. In other words, it relies on infectiousness of a disease. For easily spread diseases such as measles, a large number of immunized persons in the community are needed to reach herd immunity. As shown in this picture, the 70%. If for measles, the percentage should be higher, can be 90%. Okay, now let me use this mathematical equation to explain the herd immunity. R is the effective reproduction number, which means average person or average number of people infected by single case. In the picture here, this is the first case. We call the index cases, 2 here. If the one case infects 3 secondary cases, then R is 3. And PC is a relatively decrease in the transmission rate under non-pharmaceutical control. Here are the 2 terms I need to explain. First is the transmission rate, which is a fraction of infected people after exposure to the index case. And let's use the picture as an example. Say 10 people in the community, exposure rate is 100%. If 10 tested positive after the exposure, then transmission rate is 100%. Non-pharmaceutical control, which means the physical measures such as the social distancing, wearing masks, and washing hands, and so on. So when we say non-pharmaceutical control, I'm talking about a collection of actions, a series of actions taken to reach the non-pharmaceutical control. So in this community, if 3 people wear masks that block viral transmission between persons, then the transmission rate can be reduced by, say, 30% in this community. And RI is important parameter which is fraction of fraction of immunized person, which means the people who have protective immunity acquired through either vaccination or recovery from COVID-19. So in this community of 10 people, if four recovered from COVID-19, so let's see the green color, then the PI is 40%. The last parameter is R0, which is reproduction number of certain pathogen circulated in a fully susceptible population in the absence of intervention, meaning without any control, the reproduction of the pathogen. In other words, R0 reflects the transmission levels of a pathogen in a community. High value, meaning highly infectious of the disease of the pathogen. So the value also varies with the numerous factors such as the people's general health conditions, people's ages, viral mutations. And to reach the herd immunity, this R must be lower or equal than 1, meaning that one COVID-19 case cannot spread to more than one person in the community so that herd immunity is reached and the pandemic eventually died out. Okay, now let's take a look at the approaches to get herd immunity. First, before we start, let's first define the R0. This parameter, R0, has been determined to be between 2 and 5 for COVID-19 based on scientific data. So let's say R0 is 3. As an example, to explain how to get the COVID-19 herd immunity in 5 different ways. The first approach is the non-pharmaceutical control, and the second is a natural infection, and 3 is a partial non-pharmaceutical control during infection, and 4 is a vaccination, and last one, both non-pharmaceutical control and vaccination. Let's take a look at the first one, that is to implement non-pharmaceutical control to get herd immunity. So this is the current situation where COVID-19 vaccines are still in phase 3 clinical trials and will be available to everyone later on this year. A non-pharmaceutical control measure includes social distancing, wearing facial masks, and washing hands, and pretty much a list of long precautions as recommended by CDC. Here I want to add one more thing, that is nutrients to enhance the general health of immunity, because vitamin D and calcium deficiencies have been found to be associated with a higher death rate of COVID-19. This is shown by the research data. Then let's take a look at the equation. With a non-pharmaceutical intervention, say exposure rate is 100% and the transmission rate is also 100%. For R to be less than 1, to get herd immunity, PC is 67%, PI is 0 because no vaccine. Now let me use the picture to explain these numbers. So among the 10 people exposed here, 7 wear masks, so to block viral transmission between persons. So the transmission rate is reduced by 67%. The big drawback of this approach here is that most people isolate, say people behind facial masks are not infected, so they don't have a protective immunity against COVID-19 because they are not infected and their immunity or protective immunity is not activated by the virus. Outbreaks will happen anytime whenever they are exposed to COVID-19. Okay, now let's see. The second approach is to let people be infected naturally to achieve herd immunity. So this was also a situation in some part of the world where vaccines are not available and people were not wearing masks in the beginning. So protective immunity, as I talked before, can be induced by either infection or vaccination. So without a vaccine, say exposure rate is 100% and transmission rate is also 100%. For R to be less than 1 to reach the herd immunity, if PC is 67% and PI, if PC is 0, meaning there's no non-pharmaceutical control, and PI can be reached in two ways. One, we talked about before, one is a vaccination, and another is a infection. So without a vaccination, no vaccines so far, and to get this immunity is through natural infection, say 67%. Let me use the picture to explain the number here. Say we have community of 10 people. If let me here. Let me see what's going on here. If they are exposed, meaning exposure rate is 100%, everybody has an equal chance to get infected, then 7 of them recovered and develop protective immunity, so that herd immunity is taking shape. So this herd immunity is accomplished by a heavy cost of death of many people because people with other medical conditions have a higher death rate of COVID-19. These conditions include cardiovascular disease, diabetes, cancers, pregnancies, and immunocompromised states, such as the HIV/AIDS, and cancer patients with chemotherapy, or patients just received the solid organ transplant under immunosuppressive medication and so on. So their immune system is so down that it cannot be induced fully by the vaccination. So there's a cost. And the good news here is that most people will get protective immunity after natural infection against COVID-19. Approach 3 is to provide partial non-pharmaceutical protection of vulnerable people to reduce the death rate of COVID-19. So let's see, this is also the situation in some part of the area in the world where vaccines are unavailable, but some people were protected by wearing masks, by keeping social distance, and so on, especially those with medical conditions. Say exposure rate is 100%, and the transmission rate is also 100%. For the R to be less than 1, if PC is 20%, let's say 20%, and PI is 59%, and then herd immunity will be reached. So let me again use the picture to explain these numbers. Say we have 10 people in the community to wear masks, which represent the vulnerable people with the medical conditions. And the rest of people are infected, and I also put a mask on the persons near the vulnerable people, and to prevent or minimize the virus spread or transmission between individuals, especially those vulnerable people with medical conditions. And say then the PC transmission rate is reduced by 20%. So after infection, say we have 6 people recovered and develop protective immunity, then PI is 59%. So most people will have protective immunity after the natural infection, and say then we from this slide, I want to say here that either vaccinations or infections can induce protective immunity. Here we just take the infection as the approach. So in the absence of vaccine, healthy people are encouraged to be infected, but the vulnerable people should be protected. This is what the lesson we learn from this slide. Because healthy people are infected and their immunity is induced by the virus and remembers the virus to help form herd immunity. And then the vulnerable people will be protected in herd immunity whenever herd immunity is formed. The fourth is to take vaccination along to get herd immunity. Say the exposure rate is 100% for R to be less than 1 to get herd immunity. If PC is 0 and PI is 67%, let's see the picture to explain the numbers. So if 67, meaning 7 persons in the community of 10 are vaccinated by the COVID-19 vaccines, then herd immunity is reached. And then the pandemic eventually will be gone. Most people, these people will get protected immunity against COVID-19 because COVID-19 vaccines will induce the immune response that will remember the virus. When we expose the same virus, our immunity are ready to fight. And so far, the mRNA-based COVID-19 vaccine is on the clinical trial, and so far the test will not cause COVID-19 and is safe to use. So when herd immunity forms, people who cannot be vaccinated, such as newborns, we talk about babies, and the immunocompromised, and we talk about those with AIDS and HIV, those with cancer, with chemotherapy, or radiotherapy, or those just get solid plant organ transplants under immunosuppressive medication. Their immune systems are under suppressive conditions, cannot be induced completely. So vaccine cannot induce protect immunity. But if herd immunity is developed, they are protected and get some protection. Okay, now let's see. Number 5 is to take non-pharmaceutical control and vaccination. So this is the approach is so to take both control measures to get herd immunity sooner. So if let's say if R is 0.998 and PC and PI both 43% to get this number, so which means 40% of which means that's here PC, meaning the transmission rate is reduced by 43% through non-pharmaceutical control, and the PI is reached by vaccination. So 43% of people will be vaccinated or higher. Then herd immunity will be reached. Pandemic will be over eventually. So let me use the picture again to explain the numbers. So you have 10 people exposed to the COVID-19, and we have 4 wear masks, and 4 people vaccinated. Altogether, herd immunity is formed. And so most people will eventually have a protective immunity after the vaccination. So after we immunize most people, including people under the mask, will be immunized. And eventually, this number will reach to 67%, and this number will be reduced to 0. At that time, and there will be no more need to wear a mask to keep social distancing when 67% of people are vaccinated. And when this herd immunity is developed, the people with medical conditions will be protected, such as new babies, newborns, immunocompromised patients, people with some other medical conditions. And again, the non-pharmaceutical control, we're talking about in the beginning. In the beginning of a vaccination, people should keep social distancing, wearing masks, washing hands and taking nutrients, especially vitamin D and calcium, to increase or enhance our general health of immunity. Okay, now I want to summarize what you heard from this video. Herd immunity can be reached in 5 different ways. The first way is the non-pharmaceutical control. In the absence of vaccine, because no vaccine is the only way herd immunity can be reached. For R0 is 3, we need 67% transmission rate reduction. Second approach is through natural infection. In the absence of vaccine, no non-pharmaceutical control, nobody wears a mask and keep social distance, then we need to get 67% people infected. This is at the cost of death of quite many people. The third one is to provide a partial non-pharmaceutical control to the vulnerable people in this case, and make them protected, isolated, and encourage young people to be infected, so to help form herd immunity. So in this case, say we have for the R03, if we have 20% of people, vulnerable people, protected, isolated, and 59% of young people or healthy people naturally infected, we can reach herd immunity. And the first approach is the vaccination alone. So it will happen later this year. So when the whole country, population, whole country, most of them vaccinated. So for R03, we only need 67% of population vaccinated to get herd immunity. So the last approach is to take both non-pharmaceutical and vaccination. In this case, you can see here the number. If transmission rate is reduced by 43% through non-pharmaceutical control, meaning keeping social distance and wearing masks, and only 43% of population, once this proportion of people vaccinated, the herd immunity will be reached. So if you compare the numbers, you can hear single control, you can get 67%, and the double control, you get 43%. This is easy and sooner to get. So which means COVID-19 herd immunity will be achieved faster when both non-pharmaceutical and vaccination are implemented. So this is the conclusion. And so both non-pharmaceutical and the vaccination measures are important. Okay, and this is references where I took the information and put them together to make this video. And so your comments are very welcome. So this during the critical pandemic seasons of COVID-19, and I need to improve my video presentation for the general education of science. And thank you for your attention.